So there are about 15 to 20 million emergency room visits for chest pain, and we need to evaluate these patients safely and efficiently. Most often in these situations, high sensitivity troponins are used, since they discriminate very nicely whether a patient has myocardial injury or chest pain without myocardial injury. The HiSTORIC trial shown on this meeting here used high sensitivity troponin I on admission and at 3 hours. And so investigators could show that by this protocol, there is a safe rule out of myocardial infarction, and it's efficient, since the time in the emergency room could be reduced by 3 hours. Importantly, when these data are translated to clinical practice, you need to be sure to have the same assay which was evaluated. It was a troponin I Abbott assay. If you use a different assay, you have to look for different discriminator values. Secondly, there was a very efficient rule out, but the cardiovascular mortality was also low in this population. However, total mortality after 1 year was in the range of 5.8%. So when we rule out the patients for myocardial infarction, we still need to consider that there may be different conditions that might be life-threatening. So we really need to evaluate the patients also long-term. So be careful, even after rule out with the troponin assay, you need to do clinical investigation in your patients. But the message of HiSTORIC is early rule out is safe, early rule out is efficient, and it helps us to really stratify the patients very rapidly.